As blood alcohol levels rise, the sedative effects deepen. The shift in GABA and glutamate activity begins to significantly affect higher-order brain regions, particularly the prefrontal cortex. The prefrontal cortex is responsible for judgment, impulse control, decision-making, risk evaluation, emotional regulation, and future consequence planning. It acts as the brain's executive center. When alcohol suppresses this region, inhibitory control weakens. The internal pause button becomes less effective. This may lead to overconfidence, increased talkativeness, risk-taking, impulsive spending, aggressive or exaggerated emotional reactions, poor boundary awareness, or driving under the influence. What feels subjectively like relaxation or confidence is neurologically reduced executive oversight. The brain becomes less capable of accurately weighing consequences. At the same time, emotional centers, including the amygdala, remain active. This imbalance can amplify emotional responses. Minor frustrations may feel bigger, humor may feel funnier, attraction may feel intensified, and disappointment may feel sharper. Reaction time slows, motor coordination declines, attention narrows, and the ability to process complex information decreases. As intoxication progresses, insight into impairment also diminishes. The person may feel more capable, precisely when their cognitive control is most impaired. This is why alcohol-related injuries and accidents often occur at levels where the individual believes they are functioning normally. Disinhibition is not simply a personality change. It is a measurable suppression of executive neural circuits. As blood alcohol concentration continues to rise, these impairments intensify, setting the stage for memory disruption and blackout. As alcohol intake rises beyond moderate levels, its effects on memory become more pronounced. Glutamate plays a critical role in learning and memory formation, particularly in the hippocampus. The hippocampus is responsible for converting short-term experiences into long-term memory. When alcohol suppresses glutamate signaling, this encoding process becomes disrupted. At higher blood alcohol concentrations, the hippocampus becomes functionally impaired. A person may still speak clearly, walk and interact, hold conversations, and make decisions. But the neural circuits responsible for storing memory are no longer functioning effectively. This is the beginning of a blackout. During a blackout, a person is conscious rather than unconscious. They may appear outwardly functional. They may laugh, socialize, argue, drive, or engage in complex behavior. But their experiences are not being transferred into long-term storage. Events are happening in real time. They are simply not being recorded. A person experiencing a blackout may repeat the same question multiple times, engage in conversations they will not remember, agree to plans without recall, or make decisions they cannot later explain. The absence of memory is not delayed recall. It is absent encoding. There are two primary types of blackouts. Fragmentary blackouts involve partial memory gaps. With cues or reminders, some details may return. En-bloc blackouts involve complete memory loss for a specific period. No amount of prompting will restore those memories. The hippocampus was offline during that time. Those memories were not recorded. Blackouts are not simply drinking too much. They represent acute neurotoxicity. They indicate blood alcohol levels high enough to significantly disrupt hippocampal function and executive control simultaneously. As alcohol concentration rises further, deeper brain regions may become affected. The brainstem regulates breathing and heart rate. At extreme levels, alcohol can suppress these functions. This can lead to respiratory depression, loss of consciousness, coma, and even death. Blackouts represent a critical inflection point along the spectrum of alcohol toxicity. They signal that the brain's memory and regulatory systems are under significant chemical stress. Importantly, repeated blackouts are associated with increased risk of injury, assault, and long-term cognitive impairment. Because insight is impaired during intoxication, individuals often underestimate their level of risk. Blackouts are not a personality issue. They are a measurable neurological phenomenon, and they mark a level of intoxication where safety becomes significantly compromised. In Part 3, we'll explore long-term impact and the brain's capacity for recovery.